OTB. We are going to be presenting a class called Queer as Fuck. This is going to be a queer sex ed class, and I'm super excited to have Dr. Kinje with us today. She is going to be the one presenting all of information. I'll have some questions for her at the end. But if you do have any other questions that you think of and you want to reach out to her, I will make sure to have her contact information available. Absolutely. Or you can always contact me as well, and I can pass on those questions to her. So why don't you go ahead and introduce yourself?
Absolutely. So I'm Kinje. I am a pelvic floor physical therapist. So I have a doctorate in physical therapy, followed by a postdoctoral specialty, and that is now followed by a specialty certification that I'm working on for sex counseling within that. So within that, I have my own private practice, The Refuge Specialty Physical Therapy, which focuses for people who don't fit in the boxes. So whether that is you have complex medical diagnoses, neurodivergence, just not fitting in terms of gender sexuality, whichever way that the system doesn't fit is my folks. So to that effect, that's what brings me here.
Mm-hmm. And you also have experience in the BDSM world?
Yes. So I have hosted groups, I have owned groups, I have led groups, I have co-founded the State Dungeon, done lots of education stuff. Yeah, that's been going for 20 plus years at this point.
I have personally been an attendee at a lot of your demos and your parties, and they're fantastic. And you are a wealth of knowledge that is outside the box, I would say. Even in the kink realm, I would say you have a lot of information that is not your standard.
I like the niches.
Yes, which I love. You've expanded my mind to know a lot.
Oh, so, yay.
Yeah. So we will get into this queer sex ed class, and I will let you take it away.
Absolutely. So in terms of when we're looking at what queer sex is and how do we do that safely, the first question is, what is queer? So there's different flavors of people, and everybody is born with whatever set of equipment you're born with. And there's a wide variety of that, even at the time of birth. But then as we progress through life, you can customize your character, you can add more flavors, just become more fully yourself. So what is queer is pretty much anything outside of cisgender and heterosexual. So it's variations in sexuality. That might be bisexuality, so attraction to self and other. It might be pansexuality, which often overlaps with a lot of different stuff. So that is attraction to the individual as opposed to the body. You have homosexuality, which is attraction to like, as opposed to heterosexuality, which is attraction to opposite. You have asexuality, which is experiencing sexuality in a more neutral way. So it might be sex averse, but it might be anywhere on the spectrum from, oh, absolutely nothing to, well, only after certain stipulations. And then there's many sundry other variants, but those tend to be some of the biggest, most common ones. So then we've got different variants in gender as well. And these often overlap, but all of these fall under the queer umbrella. So variants in gender would be anything other than what you were assigned at birth. And what you're assigned at birth is literally doctors looking at this fresh, super swollen bundle of stuff and making a guess.
We think it's this.
And sometimes it's right, and sometimes it's wrong, and sometimes, so there's so much variation in normal that we have wide ranges of, X, Y, X, X, Y, XX, X, Y, Y. and then wide range beyond that. And then there's intersex. So that would be like combinations or missing alleles that dictate sexual presentation and characteristics. So all of those are not uncommon, and to the point where intersex presentations, just on the physiological, you are born this way, on a physical side of things, is just as common as being a redhead. It is the same incidence in the population.
I did not know that.
Yeah.
I didn't realize it was that common.
It is that common.
Interesting.
Yes. So there are then all kinds of just hormonal variations. So people who would be assigned female who have high testosterone projection and might have more masculinizing features. You then also have people who would be assigned male who have low testosterone or high progesterone presentation and have soft feminine features, as what we describe as those features. So then any of those things would be considered queer. Whether an individual under that umbrella decides that they want to use that term describing themselves is entirely up to them. But generally considering the wide umbrella. So then what is queer sex? And that would be any kind of sex act that is involving queer people. So if you fall under this umbrella, anything that is something other than we have a male assigned at birth and identifying as a male who owns a erectile penile organ, and we have an assigned female with feminizing hormones who has a vaginal introitus, and they will participate in penis into vagina intercourse, and pretty much most everything outside of that can fall into queer sex. So you start looking at some of the anatomical variations. So if you want to play with a queer person, what are some things you might run into? And we already mentioned like some of those hormonal shifts and things, but you run into primary and secondary sex characteristics. So primary sex characteristics are the genital sexual characteristics, and that will be, does this person have, what kind of erectile tissue does this person have? Because that is a normal part. Everybody has it. It's all coming from the same origin. It just shapes differently as you form in utero. So what are the erectile tissues? Are there receptive organs? Are we having testes? Do we have egg producing, ovarian side of things? So in the traditional male, that erectile tissue would be the penis or the glands. In the traditional female, that would be the clitoris. Both of these are aroused and will increase in size and sensitivity with arousal. And then you've got your actual reproductive components. You've got the vaginal opening and the labia, which ends up being similar to where the testes would be in terms of as things are developing. You have the hood of the clitoris, which is coming over and protecting that delicate tissue, which is analogous to the foreskin of the penis, which has the same function. It is meant to protect the mucous membranes because our both oral tissue and genital tissue is meant to be mucous membrane. It's supposed to be moist. It's supposed to be slippery. It's supposed to have that mucous barrier. So the surface of the penis, the lining of the vaginal opening, the lining of the anal entrance as well, because that'll not necessarily physiologically for sex, but conveniently it does work that way. And then like the lining of the mouth, it's the protective barrier. So the foreskin helps protect that and allows things to slide and glide. And same thing with the clitoral hood, protects that tender tissue and allows it to slide and glide in order to stimulate nerves in a good way. So we've got all of these things for factory settings, and there's a huge range. So like the depth, when we talk about the clitoris, it is not just a nub, right?
Mhm.
It's a nub, and then it's connected to the crus, and it's got a cross, and that comes down into bulbs that are in the labia, and then it's got a couple of legs that come out along the margin of the pelvic bone. And all of that is erectile tissue and will swell with arousal. But one of the things we run into is, like, most people who own a clitoris require clitoral stimulation in order to orgasm. And I believe that is somewhere in the upper 90% range. However, that is on the assumption. So usually the body of the clitoris is toward the outside of the body for the vast majority of people. If the body of the clitoris is deep into the body, there will be minimal response to clitoral stimulation externally, and you have to access it internally.
Oh, I didn't even.
And so when you
that.
talk about people who can come from clitoral stimulation versus penetration, a lot of times that's going to be anatomical from where the placement of the clitoral body is in their body.
That makes sense. I never even thought about that. Interesting. See, I'm learning so much already. So
So it's super fun, and the more you understand that, the more options it gives you to play with it.
oh yeah. Yeah. Now I'm
So,
like, oh,
and
that
then
changes the
same
whole world.
thing in terms of like what would be analogous to the clitoral body in the female would be the prostate in the male.
Mhm.
And again, same thing, they vary in size, they vary in angle, they vary in position, but they are still going to be a very sensitive bundle of nerves that is very responsive, and how you access it is going to depend on the individual. They always have roughly the same place, but never exactly. So those nerve maps are going to be different for almost everybody. So then we have, so the size can be different, the depth and positioning can be different, the nerve mapping can be different. Like, what does that part of your body actually look like in your brain? So because our brain is the part that is taking all of the sensation and taking all of the feedback and taking all of the, oh, I needed the intimacy and I needed safety and I needed security and all the components that make it feel safe to be vulnerable and aroused, and combining that with all the sensations. So your brain is doing the master job here. And everybody's brain maps our body slightly differently. So like, if somebody has chronic pain, or there are some flavors of neurodivergence where people will be like, oh, I'm just clumsy. And a lot of times what that ends up looking like is the map, as you map it out in your brain, is actually smudged. So if you think of like a world map and you poured water on it, and it's just kind of blurry.
Mhm.
So you can actually like work with the sensory nerves and stuff to try to sharpen that map and increase the brain's awareness and being able to engage with it.
That's fascinating.
So, and then if it's really, really a sharp map, that makes it really, that's going to be the people where you can just barely touch them. They know exactly where you touched them, how you touched them, the angle, the pressure.
Mhm.
They have a very sharp map, and they're very sensitive and alert
Mhm.
to exactly what's happening.
Mhm.
Which can be a double-edged sword as well.
Yeah, very much so.
But everybody's got a different kind of brain map, as well as a physiological structure.
Mhm.
So with all of this, the overarching theme in engaging with anybody really, but especially with people who are outside of the box and might have variations that you haven't encountered as much, is creativity
Mhm.
and a sense of exploration. So you've got all of these primary characteristics. So modifications to that might be vaginoplasties and labiaplasties, so cosmetic things that people have done. I have seen male and female circumcision people. That would be a surgical alteration. There's phalloplasties, vaginoplasties, and that would be creating a structure where, like, reversing the natal structure.
Mhm.
Then we have a metoidoplasty, which would be like a halfway procedure. So what that does is lets down the ligaments attached to the clitoral body so that it can come out and protrude further and become more prominent erectile tissue.
Oh, okay.
Yeah, there are surgical procedures that only close the vaginal opening versus obliterating. There are penile pumps, There are prostheses, there are testicular prostheses, there are vaginal and rectal sling procedures. There's all kinds of supportive. So the number of things that can be altered surgically are abundant. Some are considered queer specific, but all of them alter the function and the mapping and the physiological structure of the genitalia, internal or external. So some of those are targeted toward cis individuals, some of those are targeted toward non. So you've got your secondary sex characteristics, and those are going to be primarily responsive to what hormones are circulating in your body. That's going to be things like body hair, volume, your pitch, your timbre of voice. So a deep voice tends to be responsive to testosterone. Hair, facial hair is a secondary sex characteristic. Breasts and fat depositions are secondary sex characteristics. So those things can and do change in response to whatever hormones you have circulating in your body. Those can change based on adding hormones, taking hormones. They can also be from, your thyroid's acting wonky. It could be your adrenal glands are hyperactive, and all of the hormone cascade that comes from that is like, oh, hey, I got hair coming. Like the ovaries have cysts, and suddenly we have body fat depositions where you wouldn't expect. You have hairy deposits where you wouldn't expect. It's literally just from bodies being bodies.
Yep. Bodies are weird.
Yeah, bodies are so weird, but also fascinating.
Yes, they're fantastic.
They're amazing. So that is kind of what is queer, things you might encounter. Do you want to grab?
Yes.
So some of the things, I love these books. They're just little coloring books on kind of queer and normal, just variations in anatomy and things that you might see and you might encounter. And they're creative expressions. So we've got, let me see that. So this one might be, this one has the clitoral anatomy as prominent above any introital components or holes. There's one I like in here. Let's see if I can find it real quick. Oh yeah, this one's fun. Okay, so this one's a fun one. So if you can see what you're looking at here, this would be like a metoidoplasty.
Okay.
So for here, the clitoris would have been let down, and you actually have a small phallus that has erectile tissue, but we still also, this is residual. Tolerance to actually using that opening is going to depend on the individual. Depending on, like, if someone is high in testosterone, it tends to shrink that and takes away lubrication. So you have higher risk of tearing, bleeding, pain issues, and it takes a lot more work, and you just have to play around it. Yeah. And some people will have limitations on, hey, I just don't want this played with. I don't like nipple play. I don't like having my front hole played with. They have different things of what do you want to call your parts. Yeah. Yep. And that's going to be normal for anybody. Yes. Not just queer people, but it tends to be especially common with queer folks is, look, I have issues around this part. Can we not call it that? We'll just call it this instead. Yes. So then when we start talking about, okay, sex, the two things that we like to talk about are things you can do, how do we have fun with this, and what to look out for. So what are the risks that you would want to consider, and what are things that you can mitigate that, so risk reduction. And basically the risks are always going to be either things like mechanical tearing and stuff, but again, that is the same as it would be with heterosexual interactions. And then anything that would be infectious. So on the infectious front, there's a couple different layers of types of infectious, and then there's a couple of different ways that we interact with people that make us more at risk for those. So one would be the fecal oral transmission. And that is like when you get the lettuce that's been recalled.
Mhm. Yes.
The lettuce that's been recalled, it has E. coli, something pooped in the lettuce. And if you eat it,
Unfortunately, yes.
if you eat it, you're at risk of getting the thing. And usually that's going to be like a version of E. coli.
Mhm.
So other things that have that, and these are super common with little kids because they aren't very good at wiping yet, and they're
Mhm.
really terrible about everything gets everywhere, and then they put their hands everywhere.
Yeah.
Pink eye.
Yes. Yeah.
Pink eye is a fecal oral transmission. So hepatitis A, adenovirus, which presents a lot of times as a cold. Cholera, typhoid, polio. So we don't hear about cholera and typhoid much anymore because we have modernized plumbing.
Yes. Thank God.
Right. But if you are face to genitals, and specifically if you are eating ass,
Mhm.
this is a consideration.
Yes.
Like
Which
you
is
want
not
to make
something
sure
you think
that
about when you're eating ass.
right. And like the odds that your partner is going to have cholera is
low, I would hope.
especially in this country.
Yes.
But it's not the only thing that is fecal oral, and it's just like okay, so just being aware of in terms of, hey, what kind of risk I'm safe and comfortable with, what am I okay with assuming for myself, and make sure that your partner has cleaned.
Yes.
That is so important on this to keep things as clean as possible. So whether that is just literally looking the outside, whether it is a small douche, whatever, depending on what your activity is.
Yes.
And then you've got face-to-face risk. So if you are participating in making out, you are literally just doing sensory play, missionary position, anything that has you breathing on each other and exchanging fluids, whether that the types of fluids you might encounter will be respiratory fluids. So that's airborne, droplet, anything that would be coughing, sneezing, spitting.
Yes.
And you know what? Spitting's fun.
Spitting is great.
Spitting is great.
But there's risk.
There's always risk with everything. So it's like, okay, so what are you comfortable with risk-wise? So droplet and airborne things would be we're breathing on each other.
Yeah.
And breathing on each other type of stuff, that's going to be head colds, flu, measles, rubella, chickenpox, RSV. Oh, hey, we got a person.
Oh, hey.
So RSV, whooping cough, COVID, all of those are going to be inherently risky just in terms of, hey, we're interacting at this kind of level or closer, but we're breathing on each other.
Yes.
We're sharing our air, we're sharing the space where all the droplets and stuff that are coming off of me are going to be in your space.
Yeah.
So we've got fecal oral, we've got the droplet and airborne, and then we have direct contact, which is also sometimes called fomite. And so direct contact would be skin to skin.
Okay.
Like I touch you, that is direct contact. Fomite is you touch the thing, and then I touch the thing.
Oh, okay.
So that's the difference
it
between direct and fomite.
Gotcha. Okay.
So direct has to be between us.
Mhm.
Fomite is, so when there's pathogens, there is a time period for each thing when you get the pathogen on a surface that does not have live cells to feed it. How long can it survive there to pass on?
Yeah. How long will it?
Right. So that's fomite transmission, and there's not as many things that are fomite, but HSV, pink eye, Hep B, mono, these are direct or very short time fomite. So can you get it on a toilet seat?
Maybe.
Maybe.
Very short.
But like you're following that person right after.
Yeah. Like they're up and you're already there.
Right. Exactly. And the biggest thing in terms of direct contact tends to be, do we have mucus? Because mucous membranes or tissue that is meant to be mucous membranes. So when we have circumcision, that removes the protective tissue, and those tissues are no longer mucous membranes. Because they dry out. So whether that is the clitoris or it does not matter. But whenever you have mucous membranes or tissues that are meant to be mucous membranes, that are still going to be delicate like that, or if you have broken skin or tearing or micro tearing of any kind that exposes you to the bloodstream.
Yeah.
So any kinds of mucous membrane activities or things that break skin increase the risk of that direct or blood transmission.
Mm-hmm.
And how rough you are, how lubricated you are, can increase or decrease the risk of like micro tearing.
Mm-hmm.
Like you might not see any blood.
No.
But the tears are small, and that doesn't mean there's not a tiny little bit where it can get through.
Yes.
And so that's going to be things that you would be looking at, things like HIV would be bloodborne micro tear type stuff. And, you know, again, some people are going to be like, but I really, really want that roughness.
Mm-hmm.
And that is a risk that I'm going to accept and take for myself.
That's part of your risk profile.
Exactly. So that is just part of the informed consent that you are knowing what you're getting into and choosing to participate.
Mm-hmm.
So then things that can help mitigate that risk, in terms of like the fecal oral route or direct mucosal routes, any physical barriers. So that's going to be things like the condoms. Everybody knows condoms.
Everyone.
Dental dams.
Yes.
So that would be a barrier between the mouth and whatever surface you're coming to. And a lot of people don't like them.
Yeah, they deaden sensation. For
Right,
some people.
right. Well, so do condoms.
Yes, yes.
But, you know, it's again part of your risk profile.
Mm-hmm.
And a lot of times it might be, okay, well, you know, our first couple times until we both get our tests updated and we know what we're looking at, let's just have this extra layer of precaution just in case. There can gloves.
Mm-hmm.
I love and adore gloves.
Yes.
And that is not just going to be like as a barrier, but just like, you know what? I'm rough on my hands.
Mm-hmm.
I have put my hands through so much hand sanitizing. They are dry. They might have cracks in them that I don't even know about.
Yeah.
It's not so much me protecting myself as I don't know what I touched that I might introduce to you.
Yeah.
And so out of consideration for my partner,
yeah,
if I'm going to be doing something aggressive and manual to a mucous membrane, I'm probably going to wear gloves.
I think gloves are fun.
Oh yeah, and
gloves.
Also they can have their own.
they have their own benefits.
Yeah, their own like mental games to play with that too. Just getting regular health screenings makes a big difference. Know what your risk profile is, and this is not just in terms of STIs.
No.
So this is, you get your STI screens, absolutely. Those are fantastic. Make sure that you have them. Make sure that your partners have them. Just compare notes. Make sure that, like, I don't believe in clean and not. I believe in just informed decision making.
Yeah.
And what are you cool with? Yeah. But in order to have risk-aware participation, you have to have information.
Yes.
But having the medical, keeping your health up to date stuff is also going to be, you know, do you have a bleeding disorder? Do you have a clotting disorder? Do you have something going on with your heart? Might you faint if you get too aroused? You know, you want to know what's going on with your body so that your partner can know what's going on with your body so that you can play safely together. And a lot of times it'll be fairly neutral and you don't have to worry about it a lot. But if there is something, you just want to know. And then more recently, we have PrEP and PEP. And so what those are medical interventions. One is pre-exposure prophylaxis, and that one is primarily targeted toward HIV. And what it is it's not a vaccine, but it is a preventative medication that you can take that reduces any risk of contracting after exposure before you ever have an exposure. And so that's going to be, the medications are Truvada, Descovy, Apretude. And the other thing that is good to know here is with HIV, the viral load, and this is where keeping up with your health is important. The viral load, if it's undetectable, it is untransmissible.
Oh, I didn't know
So
that.
if you have a partner who has been tested positive for HIV, but they are taking their meds and their blood work does not show active HIV, they cannot give it to you.
That's interesting. I didn't know that.
Undetectable is untransmissible.
Which that's becoming more common, which is great with all the medication.
Yes, that it can be managed.
Yep.
It can be prevented. And then there is also DoxyPEP. So PEP is post-exposure prophylaxis, which it would be doxycycline, and it's basically like Plan B for STIs.
I didn't know. I hadn't heard about this.
Yes. So, and that is just for the bacterial pathogens.
Okay.
So we're talking, gonorrhea and whatnot.
Chlamydia.
Right. It's not going to be HSV because that's viral.
Yes.
But the ones that tend to be the most common and bounce around most often. So DoxyPEP would be, okay, so I have had an exposure, and then you take a dose of DoxyPEP like a day, either the next day or the day after, and it reduces your likelihood of contracting it after a confirmed exposure by like 65%.
Oh, nice. I've never even heard of this. This is interesting.
Right? It's fantastic to
Mhm.
have as a resource,
Mhm.
especially if you're going to be very active sexually and have multiple partners,
Yeah.
and you are accepting a higher risk profile for yourself, and this is just a way that you can mitigate it.
Because you can take it even if you don't know you've had the exposure. It's just preventative. like
Just
you
as a
said.
preventative.
So especially for like
Yes.
swingers and things like that.
Exactly.
It's fantastic.
Exactly.
Yeah.
So if we are being involved with a lot of different people and we're having a lot of different contact and you don't know
Mhm.
what you've been exposed to, you can be like, you know what? I'm just going to pop one just in case.
That is awesome.
Yes.
I wish more people. I've never heard of that, and I feel like I'm pretty up to date on things.
I think you generally are.
So the fact that I haven't heard about it is interesting.
Yeah. It's only been 5 or 6 years
Okay.
that this has been known, and it's starting to become more common.
That's
It's mostly
awesome.
only been heavily marketed toward like male on male partners.
Yeah.
Initially.
Kind of like PrEP.
Mm,
Yeah.
Right.
Yeah.
Exactly, because the risk profile specifically for micro tears because of lubrication and roughness that we talked about
Mhm.
tends to be higher with anal activity. So that leads us into different kinds of activities.
Mhm. Which is the fun part.
The fun part. Yes, so all the different things you can do. We have oral, we have things you can do with your mouth, things you can do with your hands, things you can do with your genitals, things you can do with things that are not your genitals.
Yes.
The sky's the limit.
There's so many things.
There are so many things. So I kind of have broken this down into like body part and what you're doing with it.
Mhm.
So we've got oral activity. You have penetrative oral activity, which would be where you are accepting something into your mouth, or to some extent, you can use your tongue as a penetrative organ.
Mhm.
So that would be going into someone else's body. In terms of receiving, you have fellatio,
Mhm.
which is when the receiver is in control and is providing that service. And then you have erumatio, also known as skull fucking,
Oh yes.
which
yes.
is when the person who is receiving the penetration is not in control.
I love the other name for skull fucking. That's so fancy. That name.
Yes.
It's so different.
Yes. So erumatio,
Mhm.
just I think it's Latin.
I love it. And I've never heard
safe
it
bet.
before.
Ah, yay, learning all the things.
Yes, I'm learning so much.
And then we've got, so that's penetrative
Mhm.
oral activity, which is likely to carry a higher risk, again, depending on roughness,
Mhm.
and if there's any sores, or if you ate a piece of popcorn and a kernel cut you.
Yes. Bastard.
Like, we're not talking about lesions here. We're
Yes.
talking about the stupid chip that cut the roof of your mouth.
Mhm. It can be anything.
It can be anything, but that's going to increase your risk.
Yes.
Then you have your non-penetrative oral activities, and that could be oral, so French kissing, making out. It could be cunnilingus, so oral onto vaginal area, eating out the clit. Labial play, vaginal
Mhm.
play. It can be analingus, and obviously the fellatio, but
Mhm.
so playing with the butthole.
Mhm.
Then we have manual. So these are so versatile.
Yes.
You can do so much with
So
this.
much with your hands.
You can do so much with this. It's delightful. You
Mhm.
can pull hair, you can stick fingers in mouths, and there's penetration right there.
Yes. And I've seen your hands at work. They're very talented. You're very talented hands.
I practiced. Thank you. I practice all the time. So we've got fingering, which would be like a digit or two. This would be where the traditional like lesbian
Mhm.
manicure comes in.
Yep.
All of mine are clip short because I use them all the time. I have no fancy fingernails, but like the manicure where you have two short fingernails is considered to be a calling card, and it's because of using those two fingers.
Which I do love. I love.
Oh, it's
that
fantastic.
Yep.
It's fantastic. And then you get, you have fisting. Much more aggressive, much more invasive, higher risk of injury, higher risk of causing any of those micro tears or anything. And some people will love it, some people will hate it. For some people in the queer population, they're all about this. Some are absolutely not.
Yes.
So nothing is ever going to be one size fits all. And fisting is generally not this, it's this.
Yes. I've seen people get to like this, but it's very rare. It's usually
this.
Yeah.
Yes. Yep. Which is why when you see lesbians on a fist fight, it looks really good.
I'm all about it.
So then we have non-penetrative manual play, which could be massaging and playing with the clitoral body. It could be hand jobs. It could be playing with the testes. It can be any kind of playing with nipples, playing with, there's all kinds of places you can touch.
Yeah, any sort of touch.
Any kind of touch that you are doing with your hand that is not penetrative. But again, the thing that we're considering is like, I've got a cuticle that's torn. I'm going to wear gloves, or I'm just going to be aware of that and make sure that my torn cuticle is not coming up on, somebody has got a breakout.
Yeah. Yep.
Or something, had one of those stressful weeks.
Yes, exactly.
So we've got anal. Super fun.
Love it. We love it.
Absolutely. It's delightful. You have different types of penetrative activity with that. So you can have static, which would be things like plugs, beads, anything that is entering and just remaining sitting there.
Yeah.
And then you can have dynamic, which might be playing with fingers, utilizing a gland or a penis, genital penetration. That could be a dildo, that could be pegging, that could be a machine, that could, again, there are so many things. The rules are always have a flared base.
Yes, please, for the love of God.
Please always have a flared base. If you use something that is porous, do not share it.
Oh, yeah, no.
So most sex toys are porous.
Put condoms on your sex toys.
Yes, put condoms on your sex toys if you're going to share them. Or you can, if you get the really high grade silicone ones, you can sterilize those.
Yes.
If you use the metal or glass, you can sterilize those. Yes. So the condoms and the barriers are fantastic, or using material that's not going to be a problem in the first place. Please don't use malachite.
No, please.
If you've seen the thread.
Yes. I have. I was like,
never malachite.
What are we doing here?
Yeah, never malachite. In terms of anal play and penetrative play specifically, people have different levels of comfort with their amount of prep, their amount of cleanliness, their amount of comfort with exposure to, because now we're in the bowel, this is our waste disposal system for the body. Like, how much are you comfortable with encountering? Some of it's going to be inevitable if you're playing it.
Yes.
You have to be okay with, there's always going to be something, no matter how good you are at it.
Yes.
It might literally just be some lining and microscopic, but there's something.
Yes.
So a lot of people will choose to, if they know they're going to engage, utilize like a douche or an enema in order to clean in advance. There are particular techniques for that, which we don't really have time for here. The concern with that is to not do it too often, because it can disrupt your intestinal flora. And that is where you're going to run into risk of being exposed to C. diff. You're going to run into diarrhea. You're going to run into constipation issues, and just kind of messing up your bowel flora is a thing that we want to be less common if you can help it.
Yeah, it's like the amount, but also what you're using to clean as well.
Right, right. So just plain saline, fantastic. Generally, temperature will make a difference. So if it's warm, it gets more things moving. If it is cold, it makes you cramp harder.
Russell found that out the hard way.
Oh,
yes, he's like, don't use cool water. It's uncomfortable.
That's funny.
Yes.
That sounds like a good story.
Yes, it has so many.
Me too. Okay, so back on anal stuff, we had the penetrative things, and then you have also non-penetrative. And on the penetrative side, I don't know if you've seen the lube shots.
Yes.
Those are fantastic because where like the vagina is self-lubricating, the anus is not.
Yeah. And having that lube like in
and
there.
If you have it already inside, then there's a repository, so you run less risk of running out and then causing trauma to the tissue. Yeah.
We've used those, and
yes,
they're fantastic.
Yes, they're great. I love them. So we have penetrative, we have non-penetrative, which is going to be anything like the fingering, again, oral on anal, ranges of manual stimulation, any kind of sensory, that could be vibrators, that could be, oh, good golly.
Electric stuff,
heat, cold, a million kinds of different sensations, firm, soft, etc. And then we have like your standard genital sensation. So that was going to be anything that is playing with whatever you have for your fun equipment. Whether you are an innie or an outie or a both or a neither or
all the things.
Right. All the fun. And this is where things turn into, okay, well, this is just, what do we have and how do you like having yours played with?
Yes.
Which is really going to be consistent. No matter who your partner is.
Yes. The variety.
Queer, non-queer, the ground rules are going to be the same.
Yes.
So genital penetration, we have, manual, we have genital to genital, we have, this is where the penis into vagina traditional type is going to go into. I think the fun stuff, which is the non-penetrative stuff.
Yes, I love the non-penetrative stuff.
Non-penetrative stuff is great. You get rubbing, you get humping, you get pumping, you get suction, you get vibrations, you get like all kinds of creative fun things. And some of these things are going to be even more so for, say, your partner might have a psychic dick and had a metoidoplasty, and you know what, pumping that clit up.
That's what I was thinking.
Yeah, absolutely.
I had a partner who had was on T, and
which will cause the clitoris to become more prominent.
Yes, and pumping it, the great time for everyone involved.
Pumping is so much fun if that's what they're into.
Yes.
Like some people, they'll try it and be like, yeah, not for me. Yeah. Which is fine.
Yep.
So then we get to all the kinds of fun things. Oh yeah. So there was a couple that are less common other than not toys. We're still using bodies, right? So sounding.
I love
which sounding. Is kind of like half and half.
Yes.
It does utilize, it's penetrative, but it's right. Yeah. So sounding would be penetrative activities involving the urethra, which this one I would generally recommend exercising a lot of caution because the risk of urethral trauma is very, very high.
Yes, know what you're doing.
You really need to know what you're doing on that one before you go playing with it.
The first time I ever saw it was when you did it. And
right.
I've been fascinated ever since.
Yeah.
I love it.
And it can be fun. It's just also one of those, Make sure that your person who is administrating it knows what they're doing.
Yes, please.
And be careful,
Mm-hmm.
because the risk on that one is very high.
Yes.
Um,
Especially
things
if it's on
like frottage and docking, which is
Yeah.
just like genital rubbing together, scissoring,
Mhm.
grinding, and then muffing. Do you know muffing?
I know. I feel like I know the term, but it's not ringing a bell.
So muffing would be for a partner who does not have a penetrative organ,
Okay.
but still wants to be penetrated.
Okay.
We have down at the connection of the pelvis and the leg, we have the inguinal canal.
Okay.
And the inguinal canal is what the pathway and the tubes come out of to go to the testes, and then up and in, and there's a hole there. And so what muffing is basically fingering that hole.
Oh, okay. I hadn't heard that before.
Right. So
Interesting.
again, there are nerves and delicate structures that are also passing through that.
Yeah.
So similar to sounding, you kind of want to exercise caution with that, but it is a thing, and it is definitely a thing that would be more likely in queer population.
Yeah. Yeah, that definitely sounds like
than otherwise. But yeah. So where was I? Oh yes, toys.
Yes, all the toys.
We have any kind of toys that are fun. So again, penetrative, non-penetrative. So we've got strap-ons, we've got dildos, we've got machines, we've got, good golly,
Yep.
vibrators. There's a million things that can be used for penetrative. You can use things that are non-traditional, but if you are using things that are not actually considered to be toys and not actually tested for that, cover it.
Very much so.
Or have it be only single use. It's either single person or single use.
Yes. Yes.
Yeah.
You can do a lot of stuff, but yeah, like you said,
you can do a lot of stuff, but you want to make sure it's clean and that we're not going to have fomite transmission, because if you have blood and body fluid getting onto something and drying, and then yes, you can start running into issues there.
Yes.
So in terms of like material, we kind of covered some of that with the single person versus, is this something that can be shared?
Yeah.
Or is this single use? Is this single person? Or is this shareable?
Yes.
So shareable stuff is going to be things that do not touch or cause any breakage of skin. So toys that might be fine for that would be floggers, paddles. A violet wand is fine because it arcs.
Yeah.
TENS pads are not.
Oh, interesting. I hadn't even considered that.
TENS pads are direct contact.
That's true.
And running the electric current causes micropunctures.
Didn't think about that.
Yeah, so the violet wand, anywhere that path traces, causes micropunctures, and it can cause an immune response as well.
Huh, interesting. Okay.
Which is why it's really itchy the next day.
That definitely makes sense. And that's why they use it for like skincare and things like that. Okay, that makes sense.
Yes.
It's all coming together now.
Right. But it does mean so one of the things I have done with violet wands is run it through my body and then kissing with someone.
Yes.
That would be actually a high risk activity.
Very.
Because now we have mucous membranes plus micropunctures. Right.
But also so hot.
Also so hot.
So hot.
Risk assessment. I'm cool with this.
Yeah,
okay.
Yeah.
If I die, I die.
Yeah. I die happy. It's fine.
Exactly. So but because it arcs, because the contact, it's broken if you contact.
Yeah.
But the arc is where it's at. And all of those parts can be sterilized. Okay. So things that are made out of high-grade silicone can be properly sterilized. Yes. Things that are borosilicate, the glass, the metal, those can be properly sterilized. They tend to be pricier because they are tough like that.
What is your recommendation for sterilizing that type of stuff?
So outside of the actual really expensive.
Yeah, outside of like an autoclave.
Right, because I've actually priced those and thought about getting one.
That is unsurprising information for you.
Usually what I do is I have a giant pot of water
Mhm.
and I will do the boil for 20 minutes.
Yep.
20 to 40. Honestly, I will set a timer for 20 and then walk away and forget about it.
Yes.
But if you can boil it, it's gonna be good.
Russell has a dedicated
Like I
big
clean
pot.
it first. Yeah, exactly.
It's just a big
So you
pot he
clean
uses for
off
that.
anything that is visible soiling.
Yeah.
And then you let it go.
Yeah.
Yep.
Makes dick soup every so often. That's what he
Yeah.
calls it.
Yeah, exactly. And then, I just lay out my pads to catch everything. And I like to either put them in baggies or something afterward
Mhm.
so that other stuff doesn't come in contact.
Mhm.
But again, that part is going to be everybody's personal preference, because having things actually be sterile for penetration is not that important.
No. Yeah.
Our holes are not sterile.
Yeah.
Our hands are not sterile. Our mouths are not sterile. The toys don't actually have to be sterile. You just want to make sure they're clean.
Clean. Yeah. There is a difference. Sterile and clean.
Right. So you can sterilize them after use to make sure that there's no germs on them. But after that, it's like,
They're clean.
They're
That's good.
clean.
Yeah.
It's fine.
Yeah.
Right. There are some things where you actually need a sterile field, but those are going to fall under some of the more obscure kink stuff.
Yeah. That's like, your suturing and stuff.
Right.
Yeah.
Right. So in terms of just like general queer sex ed, some of getting into the more kink stuff is not as much, but broaching into some of it makes a good difference.
Yeah.
Like some rope play, you need to have your rope be a single person.
Yes.
If that rope becomes a crotch rope.
Yep. I was about to say crotch rope's got to be
If
for
that
one person.
rope breaks skin,
Like
if it
coconut rope or
rubs and you
something.
get the rope burn to the point that it broke skin, that is single person. That's your rope now.
Yep.
So some of those we don't really think about being an infection control concern, but they can be.
Yeah.
So anyway, other resources that are handy that might be worth exploring, Our Bodies Ourselves. And these are all one-on-one.
Mhm.
The Trevor Project has a lot of queer sex ed. itgetsbetter.org, Your Empowered Sexuality. They're all websites. I love and adore specifically the lube guide.
Okay.
So dangerouslily.com, and we can probably put it in there.
Yeah.
And it's just called the lube guide.
The lube guide. Okay.
Because there are so many different kinds of lubes with different formulations, with different reactivity. So like if you use silicone lube and you're using silicone toy, you are in trouble. It's going to melt.
Yes.
If you,
Mm-hmm.
if you're trying to use something like that and you're using condoms, well, you're in trouble. It's going to degrade.
Mhm.
So, but it's basically a chart of, okay, so these sensitivities, these uses, what are the bases, what are the different brands? It's great.
Yeah.
And then Teen Vogue has been phenomenal
Really?
on all kinds of sex ed.
Interesting.
Yes, like if you go on Teen Vogue and you get into their sex ed components, it has been on, they had, an infographic version of how to do anal douching.
I love that.
They have had, intros to how to do fingering, fisting, etc.
Bless them.
Like 101. So Teen Vogue has been remarkable. It has been on top of it. I've been so impressed with them.
I love that, especially since they're getting rid of sex ed everywhere.
Yeah, exactly. So if we don't have sex ed, who fills in the blanks is the teen magazine.
Teen Vogue, apparently. That's
awesome.
awesome.
Teen Vogue has really picked up.
I love that. That's fantastic.
They picked up the baton, so to say.
I'm so glad.
Yes. So that was most of what I had offhand.
Okay.
Did you have other questions?
I had a couple of questions.
All right.
That I was thinking while you were talking. One thing that I have noticed, specifically in any like sex heavy community, is the idea of it's safer to have certain types of sex, or there's very little to no risk. Specifically, lesbian sex is the predominant one. and I understand that there's less risk because
Mhm.
of a lot of the stuff we talked about. But there's some people who, it's like, well, if I'm only eating pussy or we're only rubbing pussies together, there's no risk there. Obviously,
It's
not
never going to
true,
be
but-
no risk.
Mhm,
So, and again, it's going to be, do we have mucous membranes
mhm.
coming in contact? Are there any places of broken or compromised seal of the skin?
Mhm.
But yeah, it's never going to be 100% no risk. It's just going to be what risk is acceptable to you.
Okay. Yeah. I think that's something that I commonly would see people talk about.
Yeah,
is
absolutely.
Like, oh, this is no risk, where it's like, it's not really
Well,
true. It's just low.
It might be low risk.
Yes. Yeah. Low risk.
But I don't think anything that we do is entirely completely no risk.
Mm-hmm.
Anything that we do is going to be some risk.
Yeah.
Like even literally getting up out of your bed in the morning, you could slip on the floor and fall and break your hip.
Exactly.
Sure, there's a risk there. Are you going to lay in bed? No, the risk is greater. You're going to atrophy and not be able to move anymore.
The other thing too, and this is kind of more of an abstract question about the emotional aspect of queer sex, but and this is just my view, and then I wanted to see what your thoughts on it. I feel sometimes that queer sex is a lot more fulfilling and can be a lot more connective. And I think the reason for that is a lot of the stuff we were discussing, you have to have so much more discussion.
You do.
With your partner about like what they're into, what they want their parts called, how they want their parts played with, things like that.
Yes.
And that creates a more intimate bond.
It does.
Do you think that that's
absolutely? Absolutely. You can't. I mean, you can, but not to the same extent, do the just like quick pickup play because it's not an accepted, okay, well, we already know what we're going to do.
This part goes here and we're done.
Right. Because when we're doing queer interaction, queer sexuality, then it's more, well, I don't even necessarily know what parts we have. I don't know how you like them played with. So there's more interaction. There's also just generally like consideration of, I want to make sure that I am addressing you in a way that's not going to invalidate who you are.
Yeah.
And I want to carry that over into our play.
Yeah.
And how do we interact, and what kind of dynamic do we build for that? And the negotiation process for that absolutely builds a lot more connectivity, which isn't to say you can't have that.
Yeah, that's what I was about to say.
With the heterosexual interactions, it's just not inherently built in.
Yeah.
Because we have a socialization and a cultural expectation of, well, this is just how it works.
Yeah. Penis and vagina, and we're done, and that's how that works.
Bam, bam, thank you, ma'am.
Yes.
Yeah. So one of the analogies that I really like for this is that the way that we are conditioned and the way that we learn about sexuality a lot of times is the baseball analogy. Oh, hey, I made it to first base.
Yeah. Yep.
Oh, hey, I made it to third base. I made a home run. And that gives us this expectation of we go here to here to here to here, done.
Yes. Yes.
You have a map, you don't do anything else. Where queer sexuality is more like ordering a pizza.
Oh, okay.
So we want to order a pizza.
Mm-hmm.
What do you think? What do you like on your pizza? Got any food allergies? Here's what I like on my pizza.
Okay.
Here's what I'm in the mood for tonight. Here's what my appetite is. As opposed to just, okay, I never like pineapple. Well, sometimes I might like pineapple, but it's going to be once in a blue moon.
Mm-hmm.
But, anchovies,
Not for me.
yeah, you're going to have to miss me with that. Do you like white sauce? Do you like pesto? Do you like the red sauce? How do you like your crust? And so the process of figuring out what your play looks like tends to be much more of the collaborating ordering a pizza so that you're both having a good time and really enjoying that pizza rather than first base, second base, third base.
A game where one person is winning,
so
for sure.
That's one of my favorite analogies for that.
I've never heard that, and that makes so much more sense. Because that's true.
And that's going to be true whether you're negotiating just any kind of physical interaction, whether you're negotiating for a sexual exchange, whether you are negotiating for a kink scene. any form of negotiation. The other fun thing is if you feel embarrassed about talking about it, your ingredients can be different items. So pepperoni is going to be that blowjob.
Yep. That's true.
Yeah.
Because a lot of people, there's so much.
Oh yeah.
Oh
yeah. And if nipple play is indispensable and you cannot do anything without that, that might be your sauce or the basic. That's your crust.
I love
you cannot be doing it without that. You got to have a crust.
I love that so much.
That also allows you that once you're on the same page, and then, you know, so if you're also in the, oh, we got kids. Hey, so how are you feeling about some pizza after the kids go to bed?
Yeah.
I'm really feeling in the mood for like some pepperoni double cheese.
I love
How about
that.
you?
And
then it's also kind of this non-threatening, less, it doesn't have the same layer of shame that we get so heavily put onto our discussions about all things with intimacy so often.
Yeah. Oh my gosh, that's so good.
Yeah,
I'm gonna start using that.
It's really fun.
I love that. Because like you said, it's collaborative.
It is.
And everybody's getting,
and it is based more in exploring. And so instead of it being a sequence, now we have a smorgasbord to choose from.
Yes.
And we're just going to pick our choose the ingredients that we're both in the mood for tonight.
Yes.
And it might be, well, I'd really like some pineapple. I'm really not in a pineapple mood tonight. Can we do that next week?
Yeah. You're like building something.
Yes, you are.
To following
and that partnership and the companionship in the process of building that then ends up increasing the intimacy and the trust and the connectivity.
Yeah. And then you guys get to eat pizza together, and that's fantastic.
Right. And then sometimes it makes you hungry for actual pizza. So
so there you go.
Put in the order, have your fun.
I love that. That is awesome. I've never heard that before, but I think I'm gonna
it's a fun one.
So I think that was all the questions I could think of. So thank you
Absolutely.
so much.
Oh, you bet.
This was so
It's
awesome.
a blast to talk about.
Yes, I love it. You have
it's
so
very much my thing.
Again, I feel like I'm pretty fairly educated on this topic.
So?
But as you were talking, I was like, I didn't know that, and I didn't know that, and that is so cool. I hadn't thought about that. So
there's always fun little Easter eggs.
Yes, I love it. So this was awesome. So
absolutely.
You, so much.
You bet.
If anyone is curious about reaching out to Dr. Kinje?
Yes. So my email is Kinje, Kinje, at refugept.com, REFUGE, PT, like physical therapy.com.
Awesome. So feel free to email her if you have any more questions.
Or if you have problems with the land down under.
Yes, because that is her specialty. So and then also again, hopefully we will have you on for some other classes.
Yeah, absolutely.
We talked about some other stuff. And then if you guys have any questions as well that you think of and can't remember the email address or want to message me, I can always pass it along as well.
Absolutely.
And get that back. So thank you guys so much. I appreciate it.